everyone, welcome to my channel. I'm Josie. This is my second channel, Josie Cares. And today I'm going to do an update on my video of medical common sense. I've been asked by several people to do this, and it's time that I do an update. Now, the material that I talk about is from medical side and my own personal life. I am a retired nurse, and by the way, my videos are not a substitute for professional help. I just want you to be aware of some things. And most of my information is from the Johns Hopkins Medicine. I don't just Google and take any information that I see. I make sure it's from a reliable medical site. Because let's face it, we all have our own personal opinion. But to start with, I'm basically going to talk about lymphedema. But I want to refresh, and last time I know I talked about how I have been misdiagnosed for so many years. And not saying that there are not some wonderful doctors, because there are, but there's a lot of them that are not knowledgeable about certain diseases and conditions, and they don't take the time to find out. And that's what's happened in my life. Now, I was born with a condition, a blood disease called thalassemia, also Mediterranean anemia. It was discovered in 1943, so it's not like this condition hasn't been out there forever. And generally, if your ancestors were born in the Mediterranean countries, this is really common. And if both parents have it, you don't survive to be very old. Apparently, my mother is the one that had it. And then I gave it to my older son. But the sad part about this is when I was a small child, they said I had anemia. They also said my mother had anemia. Never what type of anemia. Thalassemia is completely different than regular anemia. First of all, it's hereditary. It is not curable. But my labs are always off. There's 4 sections of my lab that are never normal. And I wasn't diagnosed until I was in my 40s. Pretty sad, wasn't it? Makes me angry sometimes when I think about how neglectful doctors were. And people with thalassemia also are not supposed to take blood thinners. I wonder how many doctors know this, and especially in the ER, or aspirin. And not supposed to take iron. And I was prescribed iron most of my life. They even gave me iron shots. It's actually a miracle I'm still here. Because thalassemia patients, their system will build up too much iron, and it could kill them. So I went to a neurologist because I was having problems with my left leg, and that's another story. And he was wonderful. He did every test possible, bone scan, everything. And when I went back to get the report, he said, "Did you know you have thalassemia?" And I looked at him like shocked. I said, "What?" And he explained a lot of things to me, which was very helpful. So that's why it's made me more aware that so many times you go to the doctor and you think, well, you know, he's a doctor, he should know. No, they don't know it all. Especially nowadays, your primary doctor, if they usually send you to a specialist. Things have changed. So not trying to say, like I said, there are good doctors, but ask questions. Don't just take what they say as gospel. Ask questions. Sometimes they also don't check what you're taking, your med list. So go ahead and just be aware. And anyway, I'm going to get to the lymphedema. Now, to start with, my mother died at 98, but the last few years of her life, her legs were absolutely horrible. She actually had sores that she lived at home until a few months before she died. They had a nurse come to her house and change the dressings on her leg. Now, I was never told she had lymphedema. I don't even know if she was ever told. It is the most misdiagnosed condition. And I was diagnosed, 3 years ago now. I have a pressure machine that worked until I had a hernia repair, and the drainage buildup. The doctor was removing the drainage, and I got a terrible infection, ended up in the hospital. And I couldn't use the machine for 2 months. And my lymphedema got worse. I've had doctors tell me that it doesn't attack the stomach. I have documentation that it does. I had a surgeon kind of argue with me when I was having stomach problems that it didn't attack the stomach. It does. There's 4 stages. When I first started with lymphedema, when I actually was diagnosed and was referred to physical therapy, and the person who did the physical therapy was a lymphedema specialist. Fantastic lady. Explained all the different stages, explained the breathing technique, and some of the exercises. One thing they didn't do, which I've been doing research on YouTube, there are some doctors, and I meant to write down his name I think he's educating actually students. But it's a great videos, and it's in many parts. And he's talking about diets. And not one doctor ever told me. The therapist kind of hinted about diets, but she didn't tell me what, we should avoid. Naturally, sugar. Sugar is the worst thing. And I've decided, because I love sugar, I've decided yesterday, I looked at it realistically and thought, okay, your legs have gotten worse. You've got to cut out all the sugar. So so far, now I have to do a lot more studies on this. I'm not knowledgeable, but one of the things they recommended too was yogurt. So it'd be the unsweetened yogurt. And I did go buy some today. But now I'm going to read some of the notes. And about this, let's start with the stages. Stage 1, abnormal flow in the lymphatic system, no signs or symptoms. That's usually, maybe you have some little bit of discomfort, but see, even when, I'm a retired nurse, but even when I was in my 30s and 40s, after an 8-hour shift, my legs bothered me. They looked great, I was young, no problems, but I always wondered about my legs. Stage 2, accumulation of fluid and swelling. Some information I got says that elevation helps. Some says no. I can guarantee you, elevating your legs does not help. When I get up in the morning, my legs are just as swollen and my feet as when I went to bed. So there's conflict there. Then on stage 3, permanent swelling that does not resolve with elevation. Pressing on the area no longer leaves a dent. Changes in the skin in scarring and thickening. And your legs become, they feel like they're thickened and they're hard. It's a weird feeling. And I actually right now think I'm on stage 3. Stage 4, skin thickens to where there's wart-like growths and extensive scarring. And that's when you can get the horrible sores. And it's not, this is actually a very serious disease. And it can be acquired by, it's hereditary for some. The lymphatic system is damaged. Say if you've had cancer, you've had chemotherapy, most people end up with lymphedema. Let's see. It says past surgeries, problems following surgeries, onset of symptoms, when did the swelling appear, history of edema. These are all the things, and even your current medications. Other medical conditions such as high blood pressure, heart disease, or diabetes. I don't have any of those, thank Lord. But the sad part about lymphedema is if it's caught at the early stages, you know, there's no cure for it. There's absolutely no cure. And I know there's a video out that Kathy Bates, who, you know, is an entertainer who has lymphedema. 4 or 5 years ago, she had a video and said, on the way to a cure. There is no cure to lymphedema. And you can check my information. You can research yourself. And please do. Lymphedema can develop in any part of the body or limb where lymph nodes or vessels have been removed or damaged. So every time you have surgery, you know, there is a chance. And I know there's a lot of people think that surgery is the cure-all. Our problem in our society, and I'm heavier than I've ever been, obesity is the problem. There wouldn't be as many knee surgeries, hip surgeries, if we didn't gain weight. And I proved it to myself when before the lymphedema occurred, I was really conscientious about watching what I was eating. And I stayed pretty slim all my life. If I gained any weight, my knees started to hurt. As soon as I lost the weight, my knees stopped hurting. So obesity is the problem. And obesity does not help lymphedema at all. Let's see. And it talks about stage 2. In this stage, the tissues now have obvious signs of swelling and do not go away with elevation. That's just repeating something I already said. There was something else. The term edema refers to accumulation of excessive amount of fluid in cells, tissues, and organs, and clinically characterized by swelling. Lymphedema is a progressive condition that occurs when the lymphatic transport system fails below the capacity needed to handle the fluid that normally leaks from the blood vessels to the lymph system. So it's an accumulation of fluid that your body cannot get rid of. So the physical therapy that they do, and when I was going to physical therapy, after the hour session, I had to run to the bathroom. And it was a certain way that the therapist massaged my legs. And you learn this breathing exercise. And there is some good ones on YouTube. Please check them out. Teach you how to deep breathe. And it's a little different than the normal deep breathing. And how to massage your stomach, your legs. It's hard to massage your own legs, I tell you that. But the main thing is exercise. And my schedule doesn't allow me to do a lot of walking. My job is sitting at a computer, which does not help. But financially, I have to do that. So, you know, we have choices in life, and we have certain things that we can't control. So my main reason to even doing an update, to let you know, if you go to your legs are swelling or you're feeling this discomfort, even in your abdomen. And by the way, there are cases where lymphedema actually attacks the head also, and the arms. And I guess what concerns me the most is when doctors say, no, it doesn't go into the abdomen. It does. And I have it in the abdomen. In fact, when the company came to measure me for, I have like their leg. I should have brought them in here and showed you. And maybe when I do another video, I will. They're Velcro, and they're like boots, but they go all the way up to my thigh. And then I have like, they're pants, but you put them on with Velcro. It's actually pretty unique. But I do have lymphedema in my stomach, and it's kind of sad when a doctor doesn't believe that. And actually, I go for a checkup to the cardiologist once a year, and he was more concerned with my legs than any other doctor. He sent me to a vascular specialist. And I so admire this vascular specialist, because they did the ultrasound and all, and he talked to me and found out about my history. And he was thinking, you know, there's a possibility of doing a vein procedure, which I had done in my right leg. And it maybe is not quite as big as my left leg, but the procedure didn't stop the lymphedema. I have problems with that leg too. So he evaluated, and he said, you know what? He said, you know, I could actually make money, but he said, since the vein procedure did not help your right leg, I'm not going to put you through that. And you can wear support stockings. For myself, they make my legs hurt more. I did find some super large ones on Amazon, of all places, and I can wear them for a short time. But when your legs get so big, you have to have them specially made. And there are hundreds of dollars for one. They're over $100 for one leg. And insurance company, mine rejected it. Which is funny, they didn't reject the pressure machine, but they rejected the support stockings. So doctor couldn't figure that one out either. But anyway, the best thing I suggest is exercise. See if your doctor will order physical therapy for you. Like I said, the pressure machine was helping me until I could not use it for a couple of months. because the infection was also in my abdomen area, and that would have been, dangerous to having this pressure in that area. So I couldn't use it. In the meantime, it progressed and it doesn't help me anymore. So I would say just be aware. Don't, when you go to a doctor, if you're not satisfied with what he's saying, and I have to say this, which is terrible about, some doctors will just accuse you of being overweight. They might not come out and say you're fat, but they'll blame it onto your obesity. Lymphedema is just not the same thing. Yes, overweight doesn't help lymphedema, but just because your legs are fat doesn't mean that it's just, if they're hurting and swollen all the time, they need to look into, figure out what is going on. And this can happen to very skinny people too. But from what I've researched, from what I've talked to different people, the biggest problem is misdiagnosed. And it also, if your legs are swollen, can be other things. And I wanted to mention too, before I was diagnosed, the doctor who did the vein procedure on my right leg said, I want to try you on diuretics, Lasix for 3 weeks. Because if it had been my heart or something else, that Lasix would have taken the swelling down, or at least to somewhat level, but it didn't touch it. So when I went back to see him, he said, stop the Lasix, you have lymphedema. He said, it's not going to help, and Lasix is hard on your liver. So, but ask these questions. If you're not satisfied with the answer, ask for a referral to see another doctor. I think what helped me the most was physical therapy. The only problem I had with that, now I haven't went for a long time, and hopefully I can start again. The therapist presented to me that, I would show an improvement for 2 days, but it helped. It was a relief. But she said, well, if I can't document an improvement, the insurance company's not going to approve. So that made me a little angry, because it did help for a couple of days. It did feel better. So next time I do this, if anyone feels like it's helpful, I only do these because this channel here, I'm not really trying to grow it. It's just, I feel like with my experience, my medical background, and some of the things that I've been through, that if I can help one person, that's all I need. I don't need to, actually my channel is growing more than I thought it would. So if you have any questions, please email me. If you want me to talk about a particular thing, email me. And my biggest thing, what I can stress to any of these type of videos, take active concern. Be concerned. Don't just say, well, he's the doctor and he knows it all, and he, because he's human. He's not God. Only God knows it all. And they do make mistakes. I can prove it with myself. And like I said, we need doctors. I've known some wonderful doctors that I've worked with in my life, but I've also met some that are not up to standard. So absolutely question when they give you a prescription. Question the med. You know, what are the side effects? Does it mix with the other meds that you're taking? And another thing, please look into diet if you have lymphedema. I have actually neglected myself on that. I got very discouraged when, actually when my lymphedema started, by the way, and I should say this, I ended up going to the ER and they claimed I had sciatica. And I don't even know how I drove myself to the ER. I was so humped over. I was in excruciating pain. They did an ultrasound because they thought, well, maybe I had a blood clot. And then they decided I had sciatica. So told me to see my primary doctor. Go to the primary doctor. My regular doctor wasn't there. Another one in the office checked me. He didn't even look at my leg. Just told me to take ibuprofen. Claimed it was sciatica. It wasn't sciatica at all. Maybe maybe, you know, I have a little sciatica, but that's not what the problem was. So, again, if you feel that you didn't get the right diagnosis and you're suffering, ask to see another doctor. Ask to have more tests. Because sometimes, you know, if we catch these things at the very, very beginning, you know, you can stop the progression at least for a while. So anyway, I need to cut this shorter. I didn't mean to go on and on, but I hope that I've helped you. And I'm going to, like I said, do more research. I'm watching this a doctor who is talking about diets, and it's a very complex, you gotta listen really close. It's very large words, a lot of medical terminology, and he's explaining how the system works, how the different foods work. But as with any disease, guess what? Sugar is our enemy. And I love sugar. Excuse me, but my allergies and my nose itches. That's not professional. But sugar is our enemy. And I have really failed in this area. I love sugar. I have to give it up. I did years ago. I gave it up for a year and a half. And I have to say, I felt so much better. In that year and a half, I never had a headache. Sugar causes a lot of problems. And by the way, one other thing, with lymphedema, you can get cellulitis, and that is not a good infection. So, and where I'm at right now on stage 3, that's a possibility. So that's where I decided, you know, come on, take responsibility, Josie, and give up the sugar. I've started, you can do leg exercises even when you're in bed. I started doing that, and I started doing the breathing exercises again, which, you know, I was taught all of this in physical therapy. I had a great therapist, like I said before, who taught me all of this stuff, and I've gotten lazy. So, thanks for watching, everyone. And by the way, if this does not interest you and I've offended someone, don't watch it. That's what I say in all my videos. Don't watch it. Just go watch somebody else. Bye, everyone.